For a project that we have called Scorecard 2.0, where we're trying to measure how much payment reform there is, what type, and what changes that's led to in the healthcare system, we wanted to measure the prevalence of ACOs, and we found that it was virtually impossible to do. And we consulted all the leading experts in the country who have been trying to do this, because there's not one definition of an ACO. So even when we tried to come up with ideas to test, like, providers who come together with responsibility for a given population of patients supported by an alternative payment model, there were challenges to that definition. So unfortunately for now, we haven't found a very good way to track ACOs. So employers were feeling frustrated by the lack of transparency that they had into their health plans' ACO arrangements. Health plans are touting how many ACO contracts they have and sharing some results, but they felt cherry-picked and not comprehensive or as meaningful as employers wanted those results to be. They want to make decisions about whether or not they should really back this approach and seek it, proactively for their population members. So we pulled employers together who are feeling this frustration and worked over a year to come up with the kinds of information that they would want to know from their health plans. And then we turned that into a standard template report that employers can ask their health plans to use in sharing results of their ACO arrangements. The hope is that employers will be able to better judge how effective this movement is, work with the health plan on ACOs that are not so effective to try to help it improve or maybe move on to something else, and ultimately have a better understanding of how well the ACO model might work for their population over time.